Hey, Dr. Bill here. We're live with another soon-to-be exciting Meet the Mentor with one of my good friends, Dr. Carlo Honrado, who works right upstairs in this building above us. Without further ado, I'm going to introduce you to my good friend, Dr. Carlo Honrado. He is an experienced plastic surgeon and artist, focusing exclusively on face, head, and neck. His practice is a combination of cosmetic and reconstructive surgery, specializing in eyes, ears, nose, as well as cosmetic facial injections, laser procedures, and non-surgical treatments to enhance and maintain beautiful looking results. I'm actually 95 and he works on me. He's a double board certified and recertified facial plastic surgeon. He graduated from John Hopkins University and graduated Magna Cum Laude, which is awesome, from the State University of New York Health Science Center, and he is a dedicated husband and father of 2 young sons, resides in Beverly Hills at Maui. Carlo, thank you for coming.
Thank you very much for having me.
Why did you become a doctor?
Great question. So I'll basically give you the short answer. I went to Hopkins, as you mentioned, and I was deciding, I wasn't sure whether I should do business or medicine.
Or dentistry.
Or dentistry, exactly. Yes. I was interested in both, but when I started taking my classes, I really love the sciences. And then truly, I took an economics class and I couldn't understand it. I was like, okay, that's it, medicine it is. And then it just continued from there. Did my biology, chemistry, all those core classes, and that's what took me to medicine. And actually, in addition to, I did play sports back in high school, so I was actually also interested in sports. And one of the things that I did at Hopkins was I worked as a sports medicine trainer.
Wow.
For several years, and so that got me into kind of combining one of my 2 passions, sports as well as medicine. So in the 4 years in medical school, really the first couple years, mostly basic science classes, but then again, that's when you get exposed to like what's out there. I had no idea ear, nose, and throat surgery existed till I actually got into med school. But what kind of drew me there actually was just were my classes. Like anatomy was fantastic. It's phenomenal, really interesting. I loved everything about the body. But for me, it was actually the intricacies and the complexity of the head and neck area that actually really intrigued me. Because actually going into med school, I was thinking, I'm doing orthopedics. Again, I talked about being a sports medicine trainer. I was gonna be an orthopedic surgeon, but again, I got exposed and I was like, wait, head and neck is really awesome. Let me look into it. And within ear, nose, and throat, there are actually like several different subspecialties that are also intriguing. So one of the reasons why I first got into ENT was actually the ear, the otology. At that point, cochlear implants were somewhat in its infancy, but to me at that point, like putting an implant in someone's ear, basically allowing them to hear, was phenomenal. So that's what got my interest in ENT.
But when you're in your first 4 years of medical school, at what point do you have to start saying, okay, I'm going to be a GP or I'm going to be a...
With some of the subspecialties like orthopedics, dermatology, like ENT is one of them, you kind of actually have to decide earlier on, because it is actually competitive. There's only about 210, 220 spots in the country. So you really kind of have to do things to show, to kind of improve your resume, your curriculum.
So after your first 4 years of medical school, then what happens?
So usually around the beginning of the 4th year, that's when you apply for your residency or internship, and it's a match process. So you go in your interview, you do your applications, you go in your interviews, and at that point, once everything is squared away, you decide you basically choose where to go.
So what if you say, you know what, I did my 4 years of medical school, I'm done. I just want to be a doctor now. Can you do that?
You can. Technically, you have your MD degree.
And this is a learning thing for these guys.
Technically, you have your MD degree, and you can actually practice. But the question is, you do have to kind of at least subspecialize in something, whether it's general medicine, psychiatry, there are many
So
different
even
fields.
if you're just like an internist, a regular internist, you don't just go 4 years and then open up as an internist. You still have to do a residency program, right?
Exactly. I'm sure it's like this for dentistry. Like, medicine is a lifelong learning process.
And so you actually did 2 years of general surgery and then went into just straight ENT.
Straight ENT, correct.
Okay, and in ENT you kind of subspecialized in plastics?
You still learn. You learn everything. So we do head and neck. At that point, I was doing head and neck cancers, sinus surgeries, treating kids. You can do allergy as well. You get the core process of ENT, and then kind of like with medical school, around the third year, I decided, I kind of want to subspecialize. I want to do something a little bit more, get more training in that, and that's when I decided to go into facial plastic and reconstructive surgery.
So as a facial plastic surgeon today, what are like the top 3 procedures that you're doing on a day-to-day basis?
I think, well, number one is definitely noses. For my whole training since I started in '99, like again, the head and neck is my focus, but the nose is the main focus. And so rhinoplasty, either cosmetic, functional, meaning like you can actually help someone breathe or you fix someone's broken nose. That's probably the number one procedure that I do. Cosmetic.
Now let's back. There are some plastic surgeons who really focus on noses, but they actually even will say, I really specialize or focus on doing reconstructive work for bad nose jobs, or I actually know a guy who only does Asian noses.
Right.
Like that's his whole practice. I know
That's
another
correct.
doctor who only does African American noses. Like that's his whole practice. So are you that specialized, or?
I'm not that specialized. Well, I'd say I actually do a lot of reconstructive work where people have had prior surgery and I fix it.
And then there's other that won't even touch a nose if it's been done before.
That's correct.
Like one of my friends who's a very well-known nose surgeon says, if it's been touched, I don't want to do it.
Right.
Like I don't want to put my name on it.
I know who you're talking about. And
Yes, you know who he is.
And I totally understand that. So, with any sort of repeat surgery, actually, there's always a challenge.
It's harder.
And I'm sure it's like that with the teeth as well. When someone has worked on it before,
Right.
There's always been there's a trauma to that to what's been worked on, and it's just a little bit more difficult. So having sort of experience in it is actually really helpful for the patient.
So surgically, your number one procedure are noses.
Correct. And then the next 2 would be like a combination. Actually, 3 would be like eyes, ears, and face.
Okay.
So eyes meaning taking care of the excess skin, whether it's on the upper eye, lower eye. For the face, like tightening up the face. A lot of people do this in the mirror, they look better that way. Those are things that I can address, whether it's surgical or even non-surgical. And then ear pinning. I actually do a lot of ear pinning in the office. People who have prominent ears. So a lot of times people do it as a kid, but people even do it as an adult.
Okay. And in the non-surgical arena, what are you doing mainly?
I have a lot of heating devices that help kind of tighten the tissue and skin, both underneath as well as on top. So it's a less aggressive way to kind of treat facial aging. And some people, in this day and age, it's nice that we have modalities that are there.
Do you really think those work?
To a degree.
Yeah.
To a degree, and I do think some of the machines out there are very operator dependent. You really have to know the machine and know how to use it. It's not just a cookie cutter process. You have to understand. You have to understand the anatomy, and that's why I tell people when I'm doing things, whether it's surgical or non-surgical. In my mind, I'm always thinking, what is going on underneath? What's the tissue that looks like underneath? So, do they work? Yes. Do they work as well as surgery? Really, surgery is gold standard. It's been like that for many years, but the technology has slowly started to improve, where we do have these non-invasive routes.
All right, let's switch gears. So you're a doctor, you're a plastic surgeon. Being well qualified, well trained, and all that is only a small part of how successful you're going to be as a doctor.
That's correct.
Like, how do you actually grow your practice? And it's funny. I mean, I know the answer, but I want to hear from you. But it's funny because I know some dentists that are amazing operators, like great, like we call them golden hands, right? They're empty. Like, they have no patience. I know other guys that are really schlocky, like bad dentists. Like, I look at their work, I'm like, oh, dude.
Right. Then you fix
and they're booked up for like months. So, ideally, you want to have the steak and the sizzle,
correct.
Right?
Very true.
So, but that doesn't always happen. But how do you balance that with your practice?
I mean, that's a great question. I think the bottom line is really having a core group of staff members who just work well and work well together. And that's one aspect of things, because I can't do everything myself. I can't, greet the patient in the door, check him in, bring him to the back. I can't. You need to have a good staff, good process, from the get-go, from the time the patient calls till the time the patient leaves. So that is, to me, one of the key things, having a good base in the office, getting good quality.
But what about, that's all great, like when you have a patient sitting there, but we talk about internal marketing versus external marketing. Internal marketing is where my patients come in my office, patients come in your office, and you want to provide a gold-plated customer service kind of treatment for them, so that hopefully they walk out and they tell their friends, and they write great Yelp reviews, and they write great Google reviews, and all that stuff is all great. But there's a whole group of people who don't know you that you want to get into the office. And so how do you try to attract those kinds of patients?
Good question. So, in that respect, I do think like word of mouth is sort of the best way to kind of it's a slower process, but it's a more stable process in terms of growing word of mouth, and having doctors, patients, colleagues refer people to me. That's key. But nowadays, like, social media is really helpful. Social media, as well as having a quality website, so people can go onto the website and say, look and see what I do, look at my credentials and such.
And you've been practicing how many years now?
I've been in practice for 15 years.
Wow.
But actually here in LA for about 11.
And you're also practicing in Maui?
I go to Maui periodically. That's something that just happened about 5 years ago. I love the water, I love the beach and such, and it was something that happened that I took advantage of, in terms of like being able to go there, see patients, take care of patients, operate, and just, again, smelling the air of Maui is awesome.
That's awesome.
Yeah.
So if you could wave a magic wand and say, this is what I want my practice to look like 5 years from now, what's that vision?
Great, that's a great question.
By the way, he has a beautiful office, and he's
Thank
on
you.
the 17th floor of this building, which is the 2080 building. And if people want to find you, what's the best way? Website or?
My website is probably the best thing. It's
Which is?
drhonrado.com, drhonrado.com. But yes, in terms of 5 years from now, honestly, right now, I'm really happy with what I'm doing. Could I be busier? Yeah, absolutely. I'd love for that. But what I try to do as best as possible is to take care of my patients as much as possible. So I like to spend the time with them. I don't want to spend 2 minutes with them, 3 minutes with them. I like to spend my time with them. So it's just kind of continue the process. Yes, getting busier would be great.
Anyhow, thank you so much.
Thank you very much.
And you are such a sweet man. He is taking care of my kids, my ex-wife, myself. He's a really, really great guy. And my mom, of course. Oh my gosh, you've helped mom so much. And if you need to get a hold of Dr. Honrado, you can go to his website. Again, is
drhonrado.com.
Spell it.
drhonrado.com.
Yep. Dr. Bill, over and out.